The hidden danger lurking in your morning. If you're over 65, I want you to listen closely, because the next 5 minutes could change everything. Every morning, millions of older adults wake up and follow routines they've done for years, maybe decades, without ever questioning them. They brush their teeth, grab their phones, pour a hot cup of coffee, simple things. But what if I told you that some of these familiar habits might be silently increasing your risk of stroke? Stroke is the second leading cause of death worldwide, and the #1 reason many older adults lose their independence. And here's the frightening part. Most strokes happen in the early morning, often within the first 30 minutes after waking up. That's not a coincidence. Your body is most vulnerable right when you rise. Your blood pressure surges, your heart works harder, and your brain is adjusting from sleep. And what you do during that time can either protect you or put you in serious danger. So let's walk through 5 common morning habits that raise your stroke risk, and more importantly, how to fix them. Habit 3 especially is one almost everyone does without realizing the risk. Stay with me until the end. This might be the most important health tip you hear this year. The 5 morning habits that quietly endanger your heart and brain. Habit 1, skipping breakfast or eating too late. It might not seem like a big deal. Maybe you're not hungry. Maybe you think skipping breakfast helps with weight. But for older adults, missing that first meal can actually harm your body, not help it. After a night of fasting, your blood sugar drops. In response, your body releases stress hormones like cortisol, which raise your blood pressure and put extra strain on your heart. Your blood also becomes more concentrated, making clots more likely. Studies show people who skip breakfast are more prone to strokes, heart attacks, and high cholesterol. The fix? Eat something small within an hour of waking. A slice of whole grain toast, a banana, or a few soaked almonds is all it takes to gently fuel your body and protect your brain. Think of it like this. Would you drive your car without gas? Your body and mind need that early nourishment to start the day safely. Habit 2. Reaching for screens right after waking. Do you check your phone or turn on the TV first thing in the morning? It's an easy habit, but a dangerous one. When you expose your brain to stress, like alarming news, messages, or bright screens, before your body's ready, your cortisol shoots up. Your blood vessels tighten, your heart rate speeds up, and your blood thickens. For those with high blood pressure or stiff arteries, this morning stress can tip the balance toward a stroke. Even the blue light from devices can disrupt your body's natural rhythm and worsen your sleep-wake cycle. Instead, try easing into your day. Breathe deeply, stretch gently, let your body wake naturally, not through a flood of news and notifications. This simple change can lead to calmer mornings, better moods, and a healthier heart. Habit 3. Drinking coffee before water. I know how tempting that morning cup of coffee can be, but if it's the first thing you drink, especially before water, it's a problem. After sleep, your body is dehydrated, your blood is thicker, your organs need fluid. If you start with coffee, a diuretic, you lose even more water, which increases your risk of blood clots. Plus, caffeine causes a sharp rise in blood pressure. When your cardiovascular system is already under strain from waking up, that caffeine jolt can push it over the edge. Here's what to do. Drink a full glass of water first. Add a pinch of sea salt or a squeeze of lemon if you'd like. Then wait 15 to 20 minutes before having coffee or tea. This gentle pause helps your body hydrate, adjust, and protect your heart from unnecessary stress. Many of my patients who try this report fewer headaches, better digestion, and more energy. It's a tiny change with powerful effects. Habit 4. Holding your urine too long. If you wake up and lie there holding in your need to pee, please stop. That pressure you feel isn't just uncomfortable, it's dangerous. Holding urine raises your blood pressure quickly. It stresses your heart and can trigger a stroke in vulnerable people, especially those with heart disease or high blood pressure. It also weakens your bladder over time and increases infection risk. Even just a few minutes of delay makes a difference. Your bladder fills overnight, and by morning, it's at capacity. This pressure impacts your lower organs and even your blood vessels. If getting to the bathroom is hard, consider a nightlight, grab bars, or a bedside commode. It's not about convenience, it's about protecting your life. Habit 5. Jumping out of bed too fast. This might be the most dangerous habit of all. When you suddenly sit up or stand after sleep, your blood pressure can drop quickly, leaving your brain starved of oxygen. This is called orthostatic hypotension, and it causes dizziness, fainting, and, in some cases, stroke. If you're on medications, the risk is even higher. Instead, take your time, open your eyes, breathe deeply. Wiggle your fingers and toes, sit up slowly, let your feet dangle for 30 seconds before standing. Then rise gently, holding on to something stable. This routine takes less than a minute, but it might just save your life. These aren't medical procedures. They're not expensive. They're not hard. They're simple changes to your morning routine that give your brain and heart the support they need. Hydrate. Rise slowly. Eat a little something. Wait before screens and caffeine. Use the bathroom promptly. Each of these steps works with your body's natural rhythms, not against them. And if you're wondering about supplements to help support your brain and cardiovascular health, we've listed doctor-recommended options in the description below, including omega-3s, magnesium, and CoQ10. These nutrients can reduce inflammation, support blood pressure, and protect your brain cells. But remember, no supplement can replace the power of smart habits. If you're over 65, I want you to remember something powerful. Every single morning you wake up is a second chance to protect your health, or unknowingly chip away at it. You may not feel it happening. There's no alarm bell, no flashing red lights, but that's exactly what makes it dangerous. Most strokes don't come like lightning bolts from nowhere. They're built quietly, slowly, through small, daily habits that damage your circulation, your brain, and your heart one morning at a time. And it almost always starts with how you treat the first 30 minutes of your day. Morning, the most dangerous time of day for seniors. Did you know that most strokes and heart attacks occur between 6 a.m. and noon? That's not a coincidence. It's biology. When you wake, your blood pressure naturally rises. Your blood thickens slightly due to overnight dehydration. Your stress hormones like cortisol surge to get you moving. Your heart is adjusting to the demands of an upright body. In those fragile minutes, a poor choice can tip the scale. Now here's the beautiful part. You have power. You don't need expensive treatments. You don't need to swallow a cabinet full of pills. What you do need is this: awareness, intention, a commitment to consistent, simple changes. And these changes, they're tiny, but over time, they stack up into something extraordinary. Let me tell you about one of my patients, Margaret, age 72. She was strong, independent, and sharp as a tack. But for years, she skipped breakfast, drank coffee before water, and jolted out of bed the second her alarm rang. She didn't think much of it, until one morning, she stood up too fast and collapsed. Thankfully, it wasn't a stroke. But it was a warning. That day, she came into my office with a serious look on her face. She said, "I don't want to end up in a nursing home, doctor. Cole, I want to stay in my own house with my books, my garden, and my cat. I just want to feel like myself again." And we got to work, starting with her morning. Fast forward 3 months. Margaret no longer rushes. She wakes up gently, sips a full glass of lemon water before touching her coffee, eats half a slice of peanut butter toast even when she isn't hungry, and takes 60 seconds to breathe before checking the news. Her blood pressure stabilized. Her energy improved, her anxiety dropped, and most importantly, she said she felt in control again. This what I want for you too. Why most people don't change, and why you still can. Now maybe you're thinking, I've been doing these things for years. It's too late for me to change. Let me stop you right there. The human body is incredibly forgiving. Even if you've had decades of poor habits, your brain, blood vessels, and heart can respond within days to healthier choices. I've seen seniors in their 80s reverse high blood pressure, regain mental clarity, and even prevent second strokes, all by changing their morning routine. The reason most people don't change, it's not because they don't care, it's because they don't realize how much control they actually have. They underestimate the value of small steps. But just like water carves rock over time, your habits shape your future. Your health is worth protecting. So is your life. You've worked too hard, lived through too much, and built too many memories to lose your independence to something as preventable as a stroke. Think about what's at stake: your ability to walk, to speak, to hug your grandchildren, to drive to the park, to live in your own home without needing round-the-clock care. This is not about fear. It's about preserving the life you've built and protecting the years you still have ahead. Each morning gives you that chance, but only if you slow down and take it. Let's do this together. If you've made it this far, I know one thing about you: you care. You're the kind of person who doesn't settle for good enough. You want better, and you deserve better. I'll be here for every step. Every week, I'll share more ways to strengthen your brain, your body, and your spirit. So please, if you found this helpful, tap the like button. It helps other folks like you find these life-saving tips. And if you haven't yet, subscribe, because our community is growing, and you're a part of it now. You're not alone, you're not helpless, and it's never too late to start. Stay strong, stay steady, and take care of yourself, starting from the moment you open your eyes. With care,